Well, away from the vaccinations and vaccination mandates, the Nigeria Center for Disease Control, NCDC, is the National Public Health Institute with a mandate to lead the preparedness, detection and response to infectious disease outbreaks and public health emergencies, with a vision to lead a healthier and safe Nigeria through the prevention and control of diseases of public health importance. We look at the agency, and this is under the new leadership of Dr. Ifedaya, that's the new DG of the NCDC. And joining us to talk about this is Professor Yuwale Tomori, a professor of virology. I'd like to thank you for joining us on the program.
It's my pleasure, always.
First, the NCDC as an institution in fulfilling its mandate to prevent, detect, respond to infectious disease outbreak, has it, would you say, successfully done so?
I think within the context of Nigeria, yes, it has. Working in Nigeria is not an easy thing. And for them to have achieved what they've achieved, I think it's kudos to them. They've done very well. I believe that they could have done better if they had gotten the kind of cooperation they needed from the state governments and all other agencies involved.
Perhaps we'll come back to a few of the things you've mentioned, but then what would you say, Dr. Adetifa, is up against as DG NCDC?
I think the NCDC has to move away from being the center of everything. It should become a coordinating center as distinct from being a center. Because you can't run around helter-skelter all over the 36 states of Nigeria when everybody depends on you. We must decentralize and give that ability to control and prevent disease to the state level. Then the NCDC becomes a coordinating center, not one that runs helter-skelter and answers all the 36 states. We were doing that before. States were taking care of some of this. And the federal at that time was just a coordinating position. They're in a better position to do that. And I think the new director must look forward to that, to turn it into a coordinating center rather than just the focus of all of the activities for disease prevention in Nigeria. We must strengthen our states. Lagos State is doing that, and it's probably the only state that is doing that. We need more of our states to take responsibility for preventing and controlling disease in their locality.
But that might be difficult. I mean, I've spoken to a number of NCDC officials who have said, I mean, when there's an outbreak at the subnational level, there's a responsibility of the states, the actors, the public health there to actually wade in as they are more on ground and then perhaps involve the NCDC a little later on. So they've always had that challenge. So is it a thing of sensitization, education? How do they make this coordination, integration to help public health emergencies?
You know, NCDC can't be different from Nigeria. The whole Nigeria structure is federally centered. Everybody goes to Abuja to go and collect money and other things. So NCDC can't be different. Therefore, it is a national change in which at the state level, we take care of our problems and decentralize and let the focus on federal be out of it. So that's the same thing that has to happen. I mean, you remember even health is on the concurrent list. Then the states should take care of the concurrent aspect of health and do that, not everybody running to this. Take the issue of data, for example. Part of the problems that NCDC had was the fact that the states were not providing the data they required. You remember when we started, they were saying something about we had only 2 or 3 labs that could function in the country. And then NCDC had to build that up to about 140. But then go and check what is happening right now. You saw the data. Only 1/3 of states are reporting. I heard some state governments saying they're building new labs. Of the ones that we have, check NCDC data. 40, 50 laboratories are not reporting. And so all the so-called 140 we have, what is happening to them? The states have abandoned their role and still depending on NCDC. So we need to get those laboratories functioning. Otherwise, when the next epidemic comes, these labs will no longer function. And then we start all again and say, oh, when this epidemic came, Nigeria had only 2 labs. We must move on. We can't be going back and forth, as we're doing right now.
And if we were to center this to the coronavirus pandemic response, what would you expect should be his prime concern, especially looking at the numbers and looking at the global angle as well to the pandemic?
Thank you very much. I think the foundation is what is important. I mean, like I mentioned, it should be able to get the NCDC away from being the be-all and all of it. I use the word coordinating center. That's what it needs to do, to make sure that, they provide assistance to states when needed. But the states, just like one of their own people said, that basic activity, they are right on ground. So it should make sure that the NCDC becomes that central thing. Let me give you one good example. You remember when some people, like the monkeypox got out of Nigeria some times ago? It was like a PHC that detected it. The only time they called the American CDC was when it involved people traveling outside of the country. The diagnosis, the detection, the treatment was done at the PHC level in the US. And that's why CDC can do what it's able to do, because it can then do other things. So Dr. Dedifa must make sure that, the states are strengthened, the labs, the PID and public health are put in right place so that they can focus more on the general national thing.
Professor Iwale Tomori, Professor of Virology, many thanks. Always a pleasure having you join us on the program.
It's my pleasure. Thank you.
Still ahead on the program, the UAE gives the green light for Pfizer vaccine administration to children from 5 to 11-year-olds. Please stay with us.